Thank you. Health is basic to everything. Health is one of our surest guarantees of life, liberty, and the pursuit of happiness. Our good news is that we have come together as a community to address the underlying social determinants of health to improve our community's health. Now, most people think about health as an individual responsibility, but are there factors that contribute to their individual choices? Right now, our overall community's health looks like this. What is linking these health outcomes? And are there factors to these individual choices? Yes, there are. These are called the social determinants of health. They include your physical environment, your social environment, your economic environment, and yes, your lifestyle and behavior. All of these factors influence a person's health and well-being. The traditional medical system can't address all of these factors to give us the keys to positive health in our community. There is no single overarching solution when it comes to addressing the factors of the social determinants of health, which is why it is important to have a diverse group of public and private partners to institute healthy change. Pathways to Health partners, in collaboration with the Tulsa Health Department, have launched a Community Health Improvement Plan, aka CHIP, in January of 2017. This CHIP was the first step towards true community-centered planning, integration, and implementation of strategies to improve our community's health. CHIP was designed for and by residents to improve our health for the next 3 years, and more than 65 community partners made up the steering committee to develop this plan in the fall of 2016. More than 40 organizations were represented on that steering committee, and they represent a diverse group of sectors and disciplines. They worked through an intensive community health needs assessment to establish our priorities. A community health needs assessment is a systemic, data-driven approach. The information gained from this assessment helped us to identify our areas of greatest concern and identify strategies in order to effectively target these areas. Our CHNA and focus groups came up with the top 5 focus areas. Number 1, lack of education. 2, poor diet and inactivity. 3, access to healthy foods and groceries. 4, access to health care. And 5, teen pregnancy. All of these were seen to be interdependent, and so a themed approach was used and 2 priority areas emerged: access to health resources and health education and education systems. Members from our steering committee then made up a task force group. And they met and they discussed community assets and resources, health initiatives and interventions, and other opportunities and programs that we could utilize to target our top priorities. They assimilated all of this information and came up with an action plan with subsequent goals. Those action plans are ongoing and have room for as many stakeholders as possible to better inform our goals. Now, in order to further enable our task force groups to really get into helping our teams, we established a timeline and an overall view of what we could do. So it was a 3-year plan, and it'll actually be wrapping up at the end of 2019 with either the task force groups having completed their goals or made significant progress on them. As well as the Pathways to Health will be offering incentive grants and have been offering incentive grants. They're awarded twice a year, one in the spring and one in the fall. A lot of successes have already come out of this collaboration. And just a few examples are our education group has increased our active learning trainings. Our built environment group has celebrated the adoption of the GO plan in several cities for physical activity. And our food group has identified 3 convenience stores and put fresh produce in them. At the end of every year, there is an annual report with 3 pieces to it to assess our task force group's progress. The 1-page progress report is available to you at the sign-in sheet when you leave. I encourage you to check it out. The other pieces are available to you on the Pathways to Health Tulsa website. Our task force groups come together for an alliance meeting every quarter, and they share information and success stories from our community partners. Subcommittees meet in between these times as well. Again, there is no overarching single solution for addressing the factors of the social determinants of health, which is why a diverse group of public and private partners are essential to drive healthy change in our community. More than 65 partners have already joined us in our mission of making Tulsa a healthier Tulsa and a better place for everyone. So check out the Pathways to Health website, get involved, and join us in this mission. Thank you.
Walking over.